We're dealing with a coronavirus epidemic.
We are in uncharted waters.
I don't live my life in fear.
It is premature to jump to the highest level of alert.
Folks should not panic.
The coronavirus outbreak, fears, facts, and a whole lot of questions. Tonight, what you need to know to protect yourself and your family. Our special report starts now.
And welcome everyone to our special live show, Coronavirus Outbreak Special Report. I am Scott McGee, and tonight we do have a panel of experts to separate fact from fiction about this disease and the response to it. So we want to hear from you tonight. Here is the phone number. Please call us with your questions and comments for our panel of experts. The number right there on your screen, 914-378-4610. And you can also join the conversation live on our News 12 Facebook page. What are your concerns? What do you want to know about regarding this coronavirus? Well, Macy Eglin, there she is. She is with Dr. Susan Donnellan, an epidemiologist. She will also be answering your questions. So we have a lot of different options for you if you have questions about coronavirus, and I suspect you do. Joining me in the studio right now is Dr. Lewis Kohl. He is the Chief Medical Information Officer at CareMount Medical. And also joining us from Yonkers in the newsroom is Dr. Sheila Nolan. She is the Chief of Infectious Disease for Boston Children's Health Physicians based in Valhalla. I want to thank you both for coming in today.
Thanks for having us.
All right, so tonight there are right now 22 known cases in New York State. 18 of those here in Westchester County. We have become somewhat of the epicenter, and as News 12's Nadia Galindo tells us, the cases here all started with one attorney from New Rochelle.
More than 1,000 people in Westchester County under quarantine as the coronavirus spreads.
Well, it's very scary. And I think that it's scary, especially for people who are, senior citizens like myself.
Residents in this New Rochelle neighborhood on high alert after their neighbor, an attorney who commutes to New York City, becomes the first case in the county on Tuesday. A day later, it spreads to 9 people, including his wife, 2 kids, a neighbor, and family friends.
We'll make prudent decisions to protect the public's safety.
Hello, thank you for calling United Way's 211 helpline.
Westchester County activating its 211 call center in White Plains, opening up a second room so operators can handle more calls.
This is what we do, is crisis communication and being able to refer people to the programs and services they need when there is an emergency.
The state now ramping up testing. Governor Cuomo says this is only the beginning.
The number will increase because this will spread, and the number will increase because it is math. The more people you test, the more positives you are going to find.
Nadia Galindo, News 12.
All right, so today, as we mentioned, the number in Westchester itself nearly doubled. So I, again, am here with Dr. Lewis Kohl. Dr. Kohl, I guess that doesn't surprise you, does it, that we went from 1 to 10 to 22 in essentially 2 days?
Yeah, I mean, the testing has been limited. It's hard to believe that in a place like New York, where people are thousands and thousands coming in and out from all over the world all the time, that there's not more of this infection around. Mm-hmm. We just haven't really been testing the general public.
And there's been a lot of talk about testing, the fact that we haven't had enough going on. Has that been one of the things hampering our response to this virus?
It's been a bit frustrating because the CDC released a test. It didn't go to the states till very recently, and it didn't become available to hospitals or commercial labs until just this week, and they're working on getting the tests up and running. So.
Okay, so people watching this show right now, they want to know, am I safe? Are my kids safe? What should I be doing right now besides washing my hands? I'm washing my hands all the time. What is your message for people at home right now as we're just really getting started with this coronavirus epidemic?
So I think overall, everybody's going to be safe. I shouldn't say everybody, but most people are going to be safe. This is going to be, right now, it's looking like just a bad flu. If you're elderly, if you have a lot of chronic medical conditions, it can be bad for you. We've seen that. There are deaths. But for kids in particular, it doesn't seem to be much of an infection at all. It's very much like a common cold for them. For some people, it's a bad flu. It can progress to pneumonia, but in general, most people are not even going to realize that they have this coronavirus. They just think they have a cold.
Dr. Nolan, how would you answer that question?
Sure. I agree with what Dr. Kohl had said. For most people, the data that we primarily have is out of China, and for most people there, the disease has been mild or moderate. I'm a pediatric specialist, and so for children in particular, I've been paying quite close attention to those numbers. And from all the data, it seems to be, as Dr. Kohl said, extremely mild to potentially asymptomatic. Many of the cases in children were only detected because there were family and other contacts, other direct contacts, and so that's how those cases were ascertained. And a very striking statistic has been that in one of the first major releases from the Chinese CDC was that in the 0 to 9 age range, there have been 0 fatalities. So I think, parents can, hopefully breathe a sigh of relief for that. But, as with a severe flu, the flu can be very serious, and so this is a serious disease, and we need to be very cautious and careful and do everything we can not to continue the spread. And so, really following the public health department's directives and working to contain the virus and contain the spread as best we can will be extraordinarily important, and listening to the messaging.
I was going to say, well, with that in mind, let's hear from, we went out to talk to the public about what they wanted to hear. Let's hear that first question now. All right, so Rosemary, I understand you have a question. What is that question? Rosemary, are you out there? All right, we may have lost Rosemary, but let's, I can ask the question that I know that she had, which is, and Dr. Kohl, why don't you answer this for me, is talk about hand sanitizer. We understand there's been runs on Purell all over the place. We did a story yesterday that they were going for $50 a bottle on Amazon. It just sort of shows you where we are as a society right now. How effective are things like Purell and hand sanitizers if you can't wash your hands?
So the good news is you should wash your hands, and there hasn't been a run on soap yet, because washing your hands for 20 or 30 seconds is effective. The hand sanitizers with at least 60% alcohol are effective, assuming your hands are not really soiled. But if you're just shaking hands and touching doors, you're probably not soiled. So they are reasonably effective.
Good to know. Okay, let's talk to some of the other questions that we have. We've got a Facebook question right now. I understand Monica Smith out there. She wants to know what happens to those infected. Are they destined for death? Is there a chance to overcome it? So there is perhaps a response for some of the people out there. Monica, obviously very worried about her future.
Yeah, so most people are not destined for death. So we're hearing numbers across the world that 3% of the people who are getting this disease die. But realize that most people are not being tested. They're not out there testing people who have the sniffles. They don't know who is carrying it but is not sick. It's not going to end up being 3% in the United States.
One of the problems you just talked about is if we're not testing people, it is difficult to figure out a mortality rate, is it not?
Very much so. You don't know what the overall number of people are.
We know how many people die, but we don't know how many people are, as we've become told now, are out there living with it. There could be, there are a lot of people, as you suspect right now, who have coronavirus walking around Westchester, walking around New York, who have it, and unfortunately are probably spreading it and have no idea that they're sick.
Yeah, and that's the good news, is most people are going to be in that category.
Okay.
Not sick, little sick.
Okay. Let us go to Gina Bastone. She's from New Rochelle. We want to get some more of these phone calls in here. She was at Lawrence Hospital in Bronxville when the New Rochelle attorney was treated. She has a question.
That's right. My question is there a concern for the visitors or patients to contract the virus, specifically those people that were in the ER or patients being treated there prior to the patient being confirmed to have contracted the coronavirus?
Excellent question. Dr. Nolan, can you handle that one?
So, sure. So if there were people who were present during the time that the patient was in the emergency room, or I'm not sure of the exact details of exactly where his placement was, and he was coughing, there's a small chance. A brief sort of small contact, brief contact with people is probably a very limited chance for contracting the illness. You know, the public health department, when they're doing this, what we call epidemiological investigation and looking at contacts and looking at people who, you know, may have come in contact with him, you're going to look certainly first at people who would have had more prolonged and intense contact with the unfortunate man, and then sort of spread that circle out. So I think it's probably unlikely that, you know, a brief contact in an emergency room could, you know, result in somebody contracting the illness. It's in the realm of possibilities, but, you know, the best thing to do is sort of monitor yourself for symptoms. If the Department of Health, you know, does reach out and ask for, you know, you to monitor yourself at home, they may do that. That's a possibility.
Okay, well, I hope that answers your question. Certainly more reassuring information there for you. Do we want to ask some more questions, or do we want to go out to some of the questions that we got from the public? Okay. Okay. Eddie from Rockland has a question. Debbie? Debbie from Rockland. What is your question?
Yes, hi. My question is, do you consider gyms and the gym environment dangerous, or swimming pools dangerous?
Dr. Kohl.
When you're talking about an infection like this that spreads by coughing, droplets, sneezing, touching something, any place that a lot of people are, if you touch a surface where someone just coughed on, it is possible, you know, you touch it, then you put it in your mouth or your nose or your eyes. It's possible to spread it. So any place where there's a lot of people has some level of risk. The key is to stay away from folks who are coughing and sneezing and keep your hands clean.
Got it. Okay. All right. We are just getting started, folks. We want to take a quick break. We appreciate your phone calls, and we're going to be right back. Welcome back to our special live coverage, coronavirus outbreak, this special report. Remember, we do want to hear from you tonight, so call us now with your questions or any comments at the number at the bottom of your screen. And we want to continue with some of the phone calls we've had. In fact, our phones have been ringing off the hook. We got Claudia out of Cortland Manor. Claudia, what is your question?
So my question is, it looks like there's approximately 149 confirmed cases in the United States. And if you look at the death rates, that have been reported, there's about 10 to 12 of those people have perished, unfortunately. So it looks like the stats are more like a 10% death rate, but yet we're being reported that it's less than 3% in the U.S. So I just wondered if the doctors could explain to me that difference in statistics.
Good question, Dr. Kohl.
So I think that one's pretty straightforward. We just haven't been testing a lot of people. So if you're only testing the people who are really sick and have the highest risks and are coming to the hospital, and those folks are a little more likely to die, you're really not looking at the whole picture of who has this, because there are going to be large numbers of people who are not sick at all, have a mild cold. So we really don't know what number we're measuring from. So if you only know about 140 and 10 die, that sounds like a big number. But maybe it's 1,000, maybe it's 2,000, maybe it's 10,000. That same number of deaths can really be a small number.
And as you said earlier, the idea that there's 18 people in Westchester with this disease right now, you're fairly certain that that is not true, that there are maybe...
It's only a guess,
yes,
and it's only my opinion, but I think it's almost impossible that the disease is limited to those folks, or the infection's limited to those folks.
Yeah, and it's just the factor of how many. Is it twice as many, 3 times as many? We just don't know that answer. But there are almost certainly more people than that.
At least that's what I think.
Gotcha. Okay. Let's hear from Dennis Zappoli. Mr. Zappoli, what is your question? Mr. Zappoli, are you still there? Oh, we apparently have lost him. So do we have another person on the line? Or do we want to go to our social media pages? What should we go? All right, we got Elizabeth from Yonkers. Elizabeth, do you hear me?
Yes, I do.
All right, Elizabeth, what is your question?
My question is, could the doctors please be a little more specific about what the symptoms are? Yes, I do.
Okay. Dr. Nolan, can you give Elizabeth some of the more specific idea as to what those symptoms should be? Is it very much like a flu or a cold, or are we still figuring it out?
Sure. To a degree, we're still figuring it out. So it's primarily a respiratory virus, and that is what the bulk of people are presenting with. Early reports discussed a lot about fever and cough being the two primary symptoms. And so as more data has come out and more epidemiological studies looking at the patients who have been infected and who have become sick with the virus, we're trying to understand sort of the percentages of people who have specific symptoms. And so fever and cough are still the primary symptoms. There's been a more recent report from the New England Journal that showed fever not necessarily upon presentation, but maybe later in the course of illness as the disease progresses. But fever, cough, shortness of breath in those who are presenting with more severe disease. Other symptoms that have been reported are, are in smaller amounts are sore throat and runny nose. There's also a small percent of patients, in different reports it varies a little bit, but maybe 3 to 5% of patients can have some diarrheal symptoms. But primarily this is a respiratory virus, and people will be coughing and have shortness of breath. I've not seen many reports of wheezing, which we've seen with other respiratory viruses, but those fever, cough, and shortness of breath seem to be the primary symptoms that people describe.
So just to differentiate from, say, the normal flu, like body aches, one of the things that we so typically get with the flu, that may point to something other than coronavirus.
So not necessarily. So I apologize. Fatigue and myalgias and body aches and muscle aches have also been reported. So it's very, very difficult to differentiate from the flu, essentially.
Yeah. And it sounds a lot like the flu.
Yeah. Yes.
Yeah. So it is problematic to try unless you test, right? That's really the only way to know is if you test for it. Okay. Let's go to Dennis. Dennis, what is your question?
My question is, we have anything for prevention? Can we take aspirin or Tylenol or gargle with Listerine? Will that help?
Okay. Dr. Kohl, what do you think?
So there is nothing you can really take. You can try and do your best to keep yourself well, keeping your hands clean, staying away from people who are ill, eating well, sleeping well, keeping your immune system as healthy as you can. But there is no, don't look on the internet and look for solutions. If I take this pill, if I take those vitamins, that's not going to help.
Yeah, be particularly suspect of anyone trying to sell you something, correct?
Yes.
Okay. Do we have time for one more question? Do we have another person on the line? Sure. All right. Linda from Yonkers. Linda, what is your question?
This is my question. I'm in my 70s. I have a compromised immune system, and I have to go for some medical tests at New York Presbyterian Lawrence in Bronxville since the infected person was there recently. Am I safe in going there?
Dr. Nolan, can you answer that question?
I'm sorry, there's an issue with the earpiece.
I think, Linda, you said that you went to, or you're going to a place where there was the infection.
To Lawrence Presbyterian for tests, and is it safe for me to go there since I'm in an endangered category?
I think what she's saying is that she's safe to go to the hospital after it has already had someone there.
Right.
Yes, so going about your routine, but again, practice good hygiene. Clean your hands, don't rub your face, stay away from people who are coughing, and you should be able to go about your normal day-to-day.
And I think what you're saying as well is that these hospitals, once this has happened, they do a very deep, thorough clean, correct? That's something that they take.
Yeah, they certainly try and keep the facilities clean, and the virus doesn't live forever outside of a host. So probably can live a couple of hours on a hard surface, maybe a little longer on something softer where it can hide from the environment a bit, but it's not like you cough this virus on something and it's there for 3 weeks.
Gotcha. So, okay. All right, let's let's get one of our Facebook questions out there. Let's go to Mike Kaler's question, which is, after someone has tested positive, how long does it take to run its course? How long are you contagious for? I suppose another test will tell you if you no longer have the COVID-19 are you more or less likely to be infected again? All right, those are a lot of good questions there. Let's just take one at a time. So Dr. Kohl, how long does it take to normally run its course in this coronavirus?
For someone with coronavirus
Yes.
to run, I think
Yeah.
we're still learning about that. Some of the folks have been sick for a couple of weeks. Again, we really don't know the full extent, meaning if you just had the sniffles for 3 days, there are those folks out there. For the folks who are sickest, who end up in the ICU, it can be weeks. But I think for the average person, it's probably going to behave more like a cold, 3 to 5 days, 6 days. But again, we're really still learning this.
And one of the things is we've learned is that there's this 2-week window, right? Once you've been exposed, they say you got to wait 2 weeks before you can do anything again. Is that just sort of a generic thing that it tends to take 14 days? Because we probably don't know how long the incubation period is at this point, correct?
You know, the study that Dr. Nolan quoted from the New England Journal, which came out of China, and it looked like good science, they said the average person turned sick in 4 days after exposure. But we know that some folks have gotten sick as late as 14 days after exposure. So that's really the range.
Okay.
It's probably a bit shorter than that.
Can we go back to that full screen, guys? Is it still out there? Because there was a couple other questions that we wanted to answer off of that. There was a number of questions in there. All right, let's go back. There it is. Okay. How long are you contagious for? That it would appear to be, we still don't know the answer to that question, correct?
Yeah, it seems like some people are giving off the virus longer than we would expect. So,
okay. And are you more or less likely to be infected again? Is that something that can happen?
I don't think we know the answer to that. With many viruses, you get sick once and then you're resistant to it, but I really don't think we know the answer there yet.
And because in this case, we have had other coronaviruses. And this is the reason they call it the novel coronavirus, is because this is something novel, something new.
Yeah, there are coronaviruses that cause the common cold. Really a common reason for you to get common cold is to get a coronavirus, not this coronavirus.
Gotcha. Okay. Let's hear from Chris in New City. Wants to know a little bit more about hand soap. Chris.
Hello.
Hello.
Yeah.
What is your question?
How are you? My question is regarding the hand soap. Earlier you mentioned that the hand sanitizer has to be 60% alcohol. Is there some sort of guideline we should be looking for in hand soap? Like, does it have to be antimicrobial or something of the sort?
Dr. Nolan, can you
Sure.
go after that question?
Sure. So, no, there's nothing particular about the soap. I mean, the main thing that soap helps to do when you're rubbing and lathering, so when you wash your hands, you should wet your hands, then get the soap, and out of the stream of the water is rub and lather your hands, rub and lather all surfaces of your hands, get your fingertips and your fingernails, and really that sort of lathering helps to essentially, it's an emollient and helps to lift the germs off your hands, and then you rinse when you're done that 20 to 30 seconds of good lathering. And that's, you don't need a specific antibacterial soap or anything like that. Any standard soap will do, and as Dr. Kohl mentioned, I don't think there's any shortage of soap right now.
No, we're not in any danger of that right now. In fact, I think the FDA kind of told soap makers to stop saying antimicrobial because it was sort of, they saw it as being misleading.
Well, it's not only that. There were issues where you're using all these antibacterials and you're actually kind of selecting, you're breeding some really resistant bugs because they don't kill every bug.
Right.
So.
And let me just add one more thing. I went home the other day, and as soon as I got in and washed my hands. And then I went to dry my hand on our nasty, dish towel that had been sitting there for a while, which I realized I had just undone everything I had just done. Is that correct?
Yeah, you wanted what you dry your hands on should be just about as clean as your hands are when they come out of the water.
Yeah, so just learn from that. Don't just think about what you're drying. Maybe go with paper towels right now for at least the next little bit. All right, Maria from Suffern, you have a question.
Yes, hi. This is Maria from Briarcliff Manor. I'd like to give you a hypothetical. I come in contact with the disease. I'm in the process of incubating that disease. I now come in contact with I'm concerned about my grandchildren. During the incubation process, can one pass the disease to another individual?
Dr. Nolan.
Sure. So based on the data that we're seeing, it does sort of seem that in that pre-illness period, people most likely can. With some of the other coronaviruses, the SARS coronavirus from 2002 and 2003, the initial one outbreak, we didn't see much transmission until people were symptomatic for a few days. But with this one, we think part of the ability of this virus to spread so easily across the globe is that people are most likely shedding and able to spread in that period beforehand. But as I said, one of the most amazing things that we've seen with this data is that the children really don't seem to be getting ill with it, significantly ill, that they need to come to medical attention. It's really a remarkably few number of cases that the Chinese have reported in pediatric population. So I would say be more worried about going around your grandkids when they have the sniffly nose than necessarily you going around them. When you're the one who could be, incubating something.
Well, I tell you, that's very reassuring. As a father of two boys, it is very reassuring. Although I still have parents, and I'm more concerned about them right now. Okay, let's go to Facebook. Neil Ferguson has a question. If someone gets the virus and overcomes it, is their immune system more strengthened against it? I think we talked about this a little bit just a minute ago.
Yeah, the more infections you're exposed to, you probably boost your immune system a little bit. That's why teachers, grade school teachers almost never get sick. Nursery school teachers.
They've seen it all.
Because their immune systems are frequently challenged. Whether or not you'll be protected against this virus again, hard to say. But challenges to the immune system that don't hurt you are probably generally good.
Okay. Let's go to Brianna from White Plains. She wants to talk about treatment plans. Brianna.
Hi, if I contract the virus, what is the treatment plan?
Dr. Nolan, can you answer that?
Sure. So for right now, for people with sort of mild and moderate disease, the recommendation is like another cold or another respiratory infection. We don't, as far as we know, none of the sort of over-the-counter or the prescription antiviral medications like Tamiflu, which is oseltamivir, or Zofluza, which is baloxavir, which work against influenza, we don't think they have any activity against this virus in particular. For people who are admitted with, in the hospital who end up with more severe disease, there are 2 open clinical trials right now in the United States for different antiviral medications. When you look, there's an enormous number of other antiviral medications that are being evaluated to see if there's potential efficacy against this virus. And as far as prevention, there's at least 8 vaccine candidates that are being developed, and the National Institute of Health is reporting that they anticipate trials for vaccines starting this spring. So that's really unbelievable, remarkable technology advancement from prior outbreaks. There was no hope for that with the SARS, the initial SARS virus in 2002, and there's been a lot of work for pandemic preparedness and this sort of thing. So, having that, quick response. We've definitely had some delays and some frustrations in certain respects with testing, but on the horizon at least, it seems very hopeful with the treatment and potential vaccine candidates.
Okay. Thank you, Brianna from White Plains.